All right, we're back with Mike, who's still Trauma 1. Mike, what are all these papers here that you got spread out?
Well, when I organize my clipboard for the day's events, I want to make sure that I'm well stocked with the necessary 6 charts that I'm going to have out here. I'm going to make sure I have my ENAR recording for non-trauma patients that come into trauma. I'm going to have my trauma nursing assessment record for all traumas to record with.
I think those is actually any CTAS 1, 2, or 3 with a major mechanism of injury should have that trauma nursing assessment record used.
Correct. If I'm intubating, I like to have 2 tools. I have my RSI checklist as well as my RSI adult form for intubation. That's my order sheet.
Cool.
In code blue situations, I'm recording a code blue for a resuscitation for a cardiac event.
Okay, but when that's done and filled out, what do you do with that sheet?
I'm going to photocopy that sheet and I'm going to put it into my educator's office. They like to keep those sheets for data collection.
Awesome, cool.
The last thing I like to keep in here is my trauma order sheet for the physician to fill out. That is incredibly useful so that when they're calling out orders and stuff for medication, for intubation or anything, if I'm not using the RSI checklist for a trauma, I will use this and I'll write all my meds on there and have the doctor sign it.
As we said in the last video, the Trauma 1 is used for pediatrics. Is it basically the same setup for the paperwork?
Well, kind of, except for the adult things, we're going to add our pediatric assessment form as well as the PEWS score appropriate to their age.
Okay, where do we find that PEWS form? Those extra PEWS forms. I think in the trauma room here, they're actually kept in this little yellow binder, and they're all kept by age. So you can grab that there.